And these are all people who have, luckily we are fortunate to work with people who have trained across the world in these specialties. Our total team experience is more than 4,000 liver procedures, and we are all committed actually to affordable care, which is actually quite unique, at least I think so, and I'm blessed to be working with people like this. So this is basically what our team looks like in terms of the personnel who work with it. We've actually managed to do quite a number of things in the time that we have been together. We transplant very small babies. We've transplanted without using blood. We used very technology, as we have discussed about 3D printing. And we have done living donor transplants in Jehovah's Witnesses as well, where the donor and the recipient surgery was done without using any blood product. We are the first in the world to actually have done that. This is something that has actually been covered extensively in the news in India and elsewhere. We have transplanted the smallest baby in the world at 10 kilos who had a liver and a kidney transplant. And Dr. Morton would be interested to know she was referred to kidney failure. Actually had primary hyperoxaluria. Okay, so father did and we were able to do a transplant for her. So she actually had a genetic problem, which was a liver and a kidney transplant. We also have the distinction, the dubious distinction of having transplanted a pair of identical twins. So these young boys were always up to mischief. They shared everything. They found a bottle of rat poison and they shared it. And unfortunately, both of them got liver failure and both of them required a transplant. We were able to successfully do them, 2 transplants in one day, and one can only imagine what the family was going through. And this is them 2 years later, grown up and still very mischievous. We've also managed this for patients coming from across the border. This young child came to us from Pakistan. Of course, you hear the news. We aren't always friends, but luckily the livers for everybody are same, and we can actually transplant people. So this child came to us at less than 5 kilos, and we were able to transplant him a few years ago. He's done very well, and perhaps something of interest for people from here is that we actually do. So we had our first fellow come to us from Bahir Dar University in Ethiopia. He spent 1 year with us to start a successful liver program. It's not program yet, but he's doing liver op. So this is something we can potentially work together for. Since our team is committed expanding care, we are actually looking at ways of working with yourself. How we can actually work together and see whether we can develop shared experiences that can benefit your patients. Now, is it fulfilling? It depends on how you define fulfillment. So many years down the line, as we discussed, we started this journey 10 years ago. This diagram was drawn about 3 years ago by one of our children, about 7 days after a transplant. I don't look like that. I think she was still encephalopathic. But it still is among my most cherished possessions. You know, this is something that we value more as doctors. We value more than accolades or money. We value the love of our patients, and certainly from that perspective, I think that it's actually been very, very successful for us. This is what I'd say, that we always face situations where we don't have the best outcomes, right? We don't have the best situations. We have to start where we are. We have to use what we have, and we have to do what we can. Thank you so much. And like I said, luckily we have a team that can not only work together but also party together. Thank you.
Thank you so much, Dr. Sonal. Wow. Indeed, it's fulfilling. Please, you can have your seat. It's such a fulfilling job, but I believe we have lots of questions, but looking at the time, we would love to go for our coffee break for just 15 minutes. And then when we return, we can take all questions, and then Doctor would address us, and then we listen to our next lecture. So please, we can all go out now for our coffee break for just 15 minutes. So please, when you are done, you kindly come inside, and then we continue so that we can close timely. Thank you.